The Heart and Vascular Center at UCHealth Medical Center of the Rockies in Loveland, Colorado, is home to the region's largest cardiac electrophysiology program. Over the last 6 years, the EP team has invested in its culture, quality, and processes to address the needs of a growing population of atrial fibrillation patients.
When we're doing a similar case over and over again, predictability of that procedure is really key for us, and we're always coming back to quality. We've got to do a good job for the patient first and foremost, but within that, if we can move the procedure forward relatively efficiently, then we're able to take care of more people, we're able to minimize general anesthesia time, and keeping focused on keeping the patient at the center of what we're doing actually helps us be more efficient.
Our efficiency in the lab really helps our patients. It helps them feel confident and safe when they come to us. Being trained with all of the equipment and knowing what we're doing going in, we're able to answer all of their questions as we're getting them ready for a procedure. And when they come in, our ability to communicate and do things without having to ask questions over and over again and looking confident and being able to do things quickly just makes them feel like they're in good hands.
Since starting their cryoablation program in 2013, they've been able to do over 1,100 cryoablation procedures, performing over 230 in 2018. Prioritizing patients, people, and predictability has allowed MCR to improve their efficiency and exponentially expand capabilities across their 2 EP labs.
So when I think about workflow and efficiency here at MCR, I think that the thing that I start with is actually the quality of the procedure and not the workflow and the efficiency. And I think for us, really putting what we're doing and our patients and their outcome first is the thing that's really most important to us. We start with that, and then we've tried to adapt what we do and how we do it to maintain our quality and keep our quality first. So efficiency in the procedural space has changed during my time here, which has been about 7 years. And over that time, we have added cryoablation. That was actually early in my time here. And as we added it to our workflow, it really did make a big difference for reproducibility of the procedure in atrial fibrillation.
I think predictability is extremely important in any procedural-based subspecialty, but particularly in the EP lab when we're working with complex equipment, we're dealing with complex patients and complex arrhythmias. The more you can standardize your workflows and your processes, the less you're at risk for procedural errors and missing simple or complicated issues. I think from an AFib perspective, using the cryoballoon has really helped us work in a standardized fashion. I think we're less prone to interprocedural variability because of the ease of use and the success we've had in kind of routine isolation of pulmonary veins.
Medtronic's been very supportive. We've used cryoablation almost exclusively for atrial fibrillation ablation, and Medtronic has a lot of experience in both getting programs started and then providing support over time. And they've done that for us, and we've been very thankful to partner with them. I think working with industry is something that is it's required in electrophysiology today, and I think that if you don't have a dialogue with the companies that you're working with, then you miss opportunities to improve, again, for your patients, improve the products that are out there that let us do our job. And Medtronic has been available and responsive and supportive.
So our EP lab staff is a vital part of our EP program. We really can't have a successful EP program without having dedicated and invested staff. And I think the beautiful part about our group is that we really consider our EP team an EP family. I think the doctors are very engaged in training our staff and educating our staff and making sure that our staff feel like they can talk to us about anything, that they feel that they're as big a part of the case as we are, because that investment really shows itself as far as the quality of care we provide.
Work as a team, it's really nice. I would send my family here, and I have.